Welcome to Designing Healthcare That Cares, the show where we explore how to build healthcare systems where people and performance thrive. I'm your host, Dr. Laura Suttin, a physician, coach, and healthcare leader who believes that human flourishing and organizational excellence go hand in hand. Each week, I talk with leaders, change makers, and innovators about how to shift culture, lead with purpose, and tackle the root causes of burnout. Because when healthcare works for the people in it, everyone wins. Welcome to Designing Healthcare That Cares. I'm really happy to have our guest today, Dr. Natasha Beauvais. She owns and runs the Northern Virginia Family Practice, which is a 9-provider practice. She started the Concierge Medicine Academy, which is focused on teaching concierge skills to new concierge physicians with the mission of creating radically healthy healthcare, focusing on physical and mental health for physicians, with the belief that when the healthcare team is healthier, the patients are healthier. She is a board certified family physician, continues to practice, and we got to know each other through Dr. Peter Kim, who is the master connector of all physician entrepreneurs. So it's really great to have you, Natasha. Good to talk to you.
Yeah, it's fun to talk to you again, Laura. Thanks for having me.
Yeah. Okay. So tell us, how did you find concierge medicine? What really drew you and kept you in that space?
It found me. I started actually working in a traditional practice. I started in public health, and then I wanted to move into a private practice and took a job as the traditional practice arm of longstanding primary care office, where the original 3 doctors had converted to concierge medicine. And they were leaving the other half of the office open for traditional patients. And so for maybe 7 years, I ran that traditional practice with 3 physician assistants, and we had a regular traditional primary care practice. And then eventually my boss, who was a concierge physician, he had converted his practice when I joined the practice. He wanted to retire. And so he asked me a few years ahead of time to take over his practice. And at first I said no. Actually, I said no 3 times, I think, or maybe on the 3rd time I finally changed my mind. But I originally was sheepish about doing concierge medicine because I did not want to put money in between me and the patient. And he really educated me and said, "Look, you don't know what you're missing. This is really so much better care for everybody. It's better for the patients. It's better for you. You should really, really try it." And so I eventually acquiesced because I didn't want to leave my job. And as soon as I started it, I just loved it. It was a complete delight. It was a total surprise. And it was wonderful to be able to really dive in. We just had so much more time with patients. I could really think about them. I could follow up. I was calling specialists. I was really learning. And I think we just have the ability to do more when we have more time. So that was immediately great. And I've been doing that for over a decade now. And also I've been one of the physician owners of the practice for a while and bought my partner out a few years ago. And so I've been really working on better learning the business skills that we all need to learn running private practices. And then just started coaching those business skills to other doctors who want to run concierge medicine practices. A lot of those have traditionally been run by outside firms. And I think it's a skill that some doctors want to learn themselves. So I'm trying to teach those who do want to learn it.
That's so cool. Yeah, thanks for sharing. And I didn't really know your journey before, but it sounds a little different than at least what I envision in my mind is physicians who transition into concierge because they're burned out from traditional medicine, right?
Mm-hmm.
And yours was this offer from your boss to take over the concierge part of the practice, and you discovered how much you loved it. And that's 10 years ago. So that was concierge seems like it's picking up more, but well, you're the expert. You tell me. I don't know. I'm hearing about it more. Maybe it's just a confirmation bias, but are you seeing more and more physicians wanting to go into concierge medicine?
Yes, and more patients who want to receive care that way. Our practice has been around for more than 20 years in concierge medicine.
Okay, wow.
I think concierge medicine really started maybe more like 25 years ago. Maybe there were a few even 30 years ago. So it's a very well-proven model. Yeah. At least in the cities, it is definitely no longer a new thing. On the coasts, it's really, really popular and common, but all over the big cities in the center of the country, like where you are in Texas, it's really, really common. other big cities, Oklahoma, Denver, there's the concierge medicine everywhere.
Yeah, that's interesting. I follow in some of the local social media groups with other physicians, and other physicians are seeking concierge practices themselves. And
Yeah.
I think we all get frustrated, right? At seeking our own care for our families, and wanting better access to our physicians, and wanting to spend more time with our own physicians. And then, of course, as physicians, wanting to spend the time with our patients and really get to know the patients.
Yeah, I think everyone wants more time,
Yeah.
whether it's time to be able to do a better job, time to just feel like, okay, I actually did get to all of the things that were in my inbox, time to learn a new technology to make the work better, time to work out, time to sleep, time to have like real interactive time with your family or whatever you love outside of medicine. Like we all need a bit of growth and like opportunity outside of work as well as inside work.
Yeah. I mean, we're people too, and we're lifelong learners. And at least I see this, I'm sure you see this too, this kind of notion that we go through. I mean, even as young as high school and college and med school and residency, fellowship, if that's what we pursue. And we're constantly learning, constantly doing something new. And there's this striving, which can be sometimes a little bit dangerous, but there's this concept that we're always going to be getting to this next level. And then we might get out in private practice or an academic setting. And then there may be this stagnation, and we're in the same environment for several years. We don't feel like we're learning, we don't feel like we're growing or stretching, and we don't feel like we have time or energy. I mean, a
Mhm.
lot of us are starting families and maybe moving into new places, and just so much change taking place in our lives during that time. I'm just imagining like this feeling of I don't have time to learn anything new or learning new skills, or even grow in my own practice or grow in my skill sets. And it sounds like that is something that within the concierge space, there's a lot of time and energy dedicated towards that.
Yeah. In concierge medicine, we can get really, really busy doing clinical work as well. Like it can get overwhelming. A couple of our doctors have been experiencing even that. And then you realize, like, okay, like we really have to address this because we
Yeah.
are the model of the practice where we're supposed to be able to have a bit more support and balance. And so we're still learning that. But I do feel like we do have the agency to be able to take that on and say, like, okay, we really want to work on this. And so how are we going to work better together? Or how are each of us going to develop internally a set of our own guidelines that helps us set some structure with our patients, that
Hmm.
helps us make sure we get out of the room in time, make sure that we have time for follow up, make sure that we chart really efficiently. It's similar things that all practices need. I think we're wanting to work on them in a similar way. How does anyone have a healthy life when they're working in healthcare? And it's not just the doctors. How do nurses have a healthy life when they're working in the hospital?
Yeah.
How do the administrators not feel totally swamped? I mean, we had an experience a few years ago where I hadn't realized it, but our administrators were feeling swamped. When we finally did realize it, we started working with EOS, which is the entrepreneurial operating system. And it just helped us put a professional structure around what we were doing. And to be able to just even answer to that third party professional structure to give us some insight about what we were doing was so supportive. And then immediately, like the first day we started working with a facilitator, it was clear that one of our managers was just managing way too many people. And we had to just change our structure and change how we understood accountability for everybody. So learning those business skills that EOS is something that any business can learn is something that's really, really helpful for physicians. And particularly because we don't grow up in the business world.
Yeah.
I'm not particularly a natural structure thinker. And so being able to use a structure as a way to help me see how to consider thinking that way has been really, really great.
Yeah. Yeah. Just if we have people listening who don't know what concierge is, can you explain it just in a couple
Mhm.
sentences?
Sure, yeah. Concierge medicine is a membership-based way of doing medicine. Traditionally, it's been primary care, where people pay a membership fee annually, and then the doctors see a much more narrow group of patients, just a smaller number. Primary care doctors may have on their rosters somewhere around 3,000 patients, a little more, a little less. and they're kind of the person in charge of any questions or refills or appointments that need to be handled for those 3,000 people. They may not see all of them every year. And then in concierge medicine, we may have like 1/10 or 1/20th of whatever that roster is. And so we just have more time to be able to have follow-ups with people. We typically have half-hour to 90-minute visits. And if you have somebody who's got something going on, you have time to then make a phone call, talk to a specialist, talk to a family member. We do those kinds of like care coordination a lot. And when someone has something going on, we have the time to be able to schedule them, to say, can you just come in once a week for the next 4 weeks, and we'll make sure that we peel back one layer of the onion again and again and again. And we have the schedule flexibility to do that.
How do the third-party payers and insurers play into this model?
So our practice uses insurance, just like a traditional doctor's office would use insurance. We use traditional private insurance and Medicare. Some practices don't, and they go to a cash-only model, which, depending probably on the level of the cash-only, can be named either concierge or DPC. There's a lot of overlap between those models, and they can look kind of the same on paper, maybe feel a little bit different in the office. But in any case, for our practice and lots of concierge practices throughout the country, we accept insurance just like a traditional practice.
Interesting. I think a lot of people, at least when I first started learning about it, equated the DPC, the direct primary care, and concierge, and thinking that they all opted out of insurance and were only cash-based. But it sounds like a lot of concierge practices still accept insurance, and you're still billing and submitting claims and all the things that a traditional practice would do.
Yes. And there's a lot of both. Like there are concierge practices who are cash only as well. So each practice is structured however it's choosing to structure itself.
Yeah. What are you seeing are the main reasons that a physician would opt out of traditional non-concierge and move into a concierge practice? Or maybe you're seeing physicians starting practices right out of training in concierge. What are the reasons you would see the choice of one over the other?
It's usually that we work for as long as we can work in a certain environment, and then we just realize we don't feel well in it for some reason. One of our doctors worked 12-hour days. Like she would get to work at 6 in the morning and leave at 6 at night. And she did that for probably 8 to 10 years before she had a child, and then just thought, there's no way I can do this with a kid.
Yeah.
That felt normal to that doctor because 12 hours a day somehow feels normal to us. And I guess coming out of residency, that does feel better than residency. But we as physicians have a perception of what's normal that's very, very different than what's healthy, I think. And so what's healthy and sustainable and what we think that we're enculturated to understand that we need to do during residency are two different things. That story of that particular doctor is not so different from almost all of the doctors that work with us. Maybe we have a personal need that's really, really important to attend to. Maybe we have kids who have particular needs that we want to attend to. Maybe our families have particular needs. Maybe we have personal health needs that we really need to attend to. And we realize that we're spread extremely thin, and it's so challenging to be able to feel like we're doing well for all of our patients. Maybe we only have 6 hours of patients scheduled a day, but it takes 12 hours to finish all the work. And that can feel defeating.
Yeah. All of the administrative burden that we feel like we didn't go into medicine for all of that. That's burning us out.
There's a huge amount of taking care of people that happens outside of the particular visit that people are scheduled for. And that's hard to account for in the way that traditional care is run. And we all want to be able to provide all of that stuff that we should be doing outside of the exam room. I think any doctor really wants to be able to do a great job with follow-up and really thinking about the labs and looking things up when we don't understand something and talking to other people who can help us, make a better decision for this patient. And it's time consuming for all of us.
Yeah. And unreimbursed a lot of times. And that makes it a huge challenge too. All the unreimbursed time and care that is spent, which then drives physicians to see more patients because that's where the reimbursement comes in.
Yeah. I mean, I think there are new models in primary care that are beginning to support that. Chronic care management is a way that time can get reimbursed. So I won't put a blanket statement and say it's 100% non-reimbursed. There's other things you have to deal with as a medical practice owner that have nothing to do with medicine. And so, for example, one year we got kicked out of our lease and we were negotiating with the city who bought our building and wanted to put a school there. So we had no negotiating strength. And so we had some lawyers helping us out. And one of the lawyers called and spoke with one of my staff members, a very appropriate call where the staff member provided the information that he needed. And then we got an $86 bill for that 6-minute phone call. And then I realized that was his time. His time was worth $86. And we're just as well trained. And
Right.
yet we don't think of ourselves like I would never think of billing $86 for that 6-minute phone call, or at least I didn't until then. And then I thought, that's really a downside for all of medicine, that the simple administrative phone calls, I mean, this was not a high-tech type thought he was having to have at that moment, but he still needed to take the time to get that information. And we have hundreds of those throughout the week.
Yeah.
Yeah. So I think that's a real challenge to all of how medicine is practiced here.
Yeah, definitely. And I want to dive into that too, as physicians move into entrepreneurial and business owner space, is that we tend to separate our time from money. We don't really see that as physicians. If we're working in an employed model, we get a paycheck and we might not see the connection between our patient care and how much money is generated. And yet when we are business owners and entrepreneurs, we have to start thinking about it. And that's something that Peter and other coaches that worked with us started really trying to get us to think about our time as money. And that's a big shift, at least for me, than I feel like a lot of us have to make. I imagine that's something that you work on in your academy as well, too, is how to adopt those business skills. Because like you said, it's not something that we're taught in training.
Yeah, I think the two things that I would think of there are that physicians learning an entrepreneurial skill of offloading tasks to other people is something that really should be taught in medical school. And I think it's really common. Physicians are empathetic. They're constantly worried about everybody else. And so it's really common. And we get this for our doctors as well. Like, oh, I didn't want to give that to the nurse because she was busy. But the nurse goes home at 4:30. She has an 8-hour day and it's done. And the doctor is then going to make up that time on Saturday or Sunday or at night or all of those, and it's normal for us to just be doing tons of work outside of the regular workday. And so teaching the entrepreneurial thought process of just thinking, actually, it's a drain on not only me, but on my organization. I am doing something that someone else could do because I do cost more than my team members. It makes the most sense to be able to empower those team members to do the most possible. And then I can really think, oh, I have a patient with a complicated diagnosis. The only person who can talk to these 3 specialists to make sense of it is me. Mm-hmm. And so to make sure that I have all the information that I need, it has to be done by somebody else. Or even like I tried to call a hospitalist the other day and it took me probably 15 minutes to get through on the phone. Normally I wouldn't do that, but for some reason I was making those phone calls and it just reinforced to myself. It took 15 minutes for me to get this person on the phone. And that is a very poor use of the buy back your time principle, because 15 minutes of my time, I could have been spent writing somebody else's chart that they could have gotten that doctor and he could have called me. We did have a great conversation and it was great advocacy for the patient. But still, that's me. I've learned those principles and I'm not using them 100% of the time. And the other thing I would say, teaching entrepreneurial time management concepts to physicians is really, really important. This is actually still a tendril of the same, but we were talking to our doctors about making sure that our nurses were handling all of our refills. And that was handled in a variety of different ways for the different doctors in our practice. And we really wanted to systematize that, because when we create a good structure for the nurses to really follow up and say, okay, has this patient been in recently? Are we overdue for labs? Is this a chronic medication that this patient's been on for more than a year? Then we can make sure that the nurses check a bunch of safety boxes. And if those things are true, once they've gone through a collaborative training process, the nurses can refill 80% of our medicines. And then those that do require a different thought process, we can save our time to do that. And actually, that would save us almost a week's worth of time in a whole year if we make sure we really systematize that and offload that to a very good nurse who's really putting a lot of thought into it. But it's so normal for us to just think, oh, well, one of the easiest things I do is do my refills. It only takes 15 minutes, right? And so it almost feels like, let me get that easy thing out of the way, which is the wrong entrepreneurial way to think about it. We should be thinking about it as like, this is something I can teach someone else. And once I've spent the time to teach that to someone else, that person is working at the top of their pay scale. They're more engaged in their work. They're doing a really good job. And then I can move into something that is using my physician training that person can't be doing. So that's the long entrepreneurial time management for doctors.
Yeah, I think that's huge. And then also when we were talking about this before we hit record, just the translation of empowerment of the healthcare team, the physicians and the nurses, and then how does that impact the patients? And the patients are happier, right? They probably get their refill more quickly than they would have if they had waited for the doctor. And so this concept that when we take care of our physicians, we take care of our healthcare team, then the patients are going to benefit as well.
Another place where I think that's related is being on call. And so lots of doctors in concierge practices give their cell phones to their patients. And we actually don't do that typically. We rotate our call. And the concept is the same. It is that we really want the doctor to have space and time away from being on call and to really allow their brain to regroup and really connect with the other human beings in their life. And like whether they have family members or they're just involved in the community or they have physical sports that they like to participate in or arts or religious community or whatever they enjoy, not being a doctor in your off time is rejuvenating for when you get back into work, and then we can feel committed and excited about it. And so whether that's that the nurse takes some of the time so that the doctor is not doing stuff that we don't have to do, or whether that is that we rotate call for each other so that we really get some downtime, that actually brings us back into the office in a healthier way. So in terms of what you're saying, the patient gets the refill faster, or the patient gets a doctor who's not depleted. And it's hard to put that on a line item and say, this is how much money this was worth. And my doctor came to work refreshed this morning, and she actually was thinking about me on Saturday. And now, like on Monday, that thought became fully developed and we can execute on it.
I think that's so important. I had a client recently who was an OB-GYN and full scope OB and was really struggling with taking time off and not being there for her patients' deliveries and was feeling her own guilt about it. And then the patients would share when they're coming up on their delivery date that she would let them know, I'm going to be out this week or whatever. If you do go into labor, my colleague so-and-so is going to be on call and is going to attend to your delivery. And the patient's kind of freaking out thinking that this doctor that I've gotten to know for 9 months is now going to be gone. And really just this concept of it's okay for you to take time off too. And so how can she know that for herself? And then how can she also help the patient to understand too? Like, I'm a person, I need time away from the office too.
Yeah. And that patient might need to understand that starting from month 2. I've had 4 kids. Like there's always a plan that you know that you're not going to get a guarantee of the exact person who's going to necessarily be there for you. And then comfort can be built into the system. Just like it's comfortable for my patients to have the nurse call them first when they're in the hospital because she's going to get to it first. And so they all know she's going to call them first.
Yeah.
The other thing I would say is like, you had mentioned that in our group had talked about learning the value of time and really like putting a monetary value on time. I think there's also a massive health value on time. And so whether it is money or not, saving time for the physician is saving the physician. And so just this possibility that we could go home with our charts done on the same night and make it home for dinner is such an important concept that we almost don't even think it's possible, so we don't try for it. But technology actually now makes that way more possible than it used to be. And I think all doctors, even in residency, need to get exposed to this concept of the goal is for you to have your notes done the same day before you go home for dinner, and for you to feel like that was not just adequate, but great. Like you did a good job with those. You can like rest comfortably that your note is adequately documented, because at least the way I understood it, there was no way in hell I was going to get any of that stuff done. And I always just had a big pile of paper charts in the old days. And I could have probably learned a lot of skills from coaches earlier on had I known about coaches, to recognize that some of those limitations were in my own mindset.
Yeah, I think that's huge. I recently talked to Sarah Smith. She's the charting coach. I recently had her on, and a lot of what she does is mindset. It's not about technical, do your chart this way. It's very much about mindset. And so, yeah, I think that's important, that when we're taking time for ourselves, then our health in every aspect is going to be better. Yeah. So I know we're coming up on our time. You're starting up another cohort of the Concierge Medicine Academy. So tell us about that.
Yeah, so for people who are interested in concierge medicine, who want to learn business skills, we teach really early stage concierge medicine doctors some skill building and some mindset coaching around how to run their practices. It's really, really common for doctors to get into running a practice. And again, this is kind of a buy back your time principle. They feel like, oh, okay, I don't have any patients yet, so I have to do everything. And in fact, that's not really possible. And we're not really that good at doing everything. And so learning how to conceptualize, like, how do we really get off the ground? How do we decide who to offload to? How to think about using a bookkeeper to pay our bills and make sure our finances get right so that it's not a mess at the end of the year? And how do we learn to use an operating system so that we have really good structure? Marketing is a huge thing that concierge doctors want to learn. How do I get the word out that I'm available and I have a set of expertise that people want? Like, it's hard to know how to find the people that are wanting the exact service. And yet there is a huge demand for the service, and there's a huge amount of patients who are really looking for that service. And so just teaching people, first of all, marketing is not a bad word. It's a service to provide a connection point between a person with a need and a person with a skill set to solve that need. So those are the types of things that we work on.
Yeah. It sounds like it's really helpful for new docs, and just also probably building community, so you have somebody to reach out to.
Yeah, the community building part of it is really fun. I think doing it as a collective cohort is really helpful, because certain students will get a lot of insight from a different student's problem, and it may help save years of that struggle for them when they can realize, oh, I could be doing this differently right now.
Yeah. Very cool. Well, thanks so much for being here. So good to talk to you. So good to see you. Where can our listeners find you?
They can find me on my website at Northern Virginia Family Practice, or the Concierge Medicine Academy, or on LinkedIn.
Sounds good. We'll put links for those in our show notes so people can reach out to you.
Okie doke. Well, great to talk to you, Laura.
You too. Thanks so much for being on. Thanks for listening to Designing Healthcare That Cares. If today's conversation gave you a new idea or inspired you to see things differently, share this episode with a colleague and keep the conversation going. And if you're ready to take the next step in building a thriving healthcare culture, you can find resources and ways to connect with me at drlaurasutton.com. This podcast is for educational and informational purposes only. It is not medical advice, and it should not replace care from a qualified healthcare provider. Always seek the guidance of your physician or other qualified professional for any medical questions or decisions.